you very much, Professor Hani. And now we move to the next star, Dr. Rasha Darwish, Treasurer of the AFRAN.
Dr. Rasha Darwish is مش هقول بقى يعني my colleague since a very long time. And she has been a very enthusiastic nephrologist all over the different years. And due to her perseverance, she gained with excellence the position of treasurer of AFRAN and also the position of being in charge of the peritoneal dialysis shed. Professor.
Thank you so much, dear Professor Hani, for your very nice introduction and for your beautiful presentation. I want to thank Professor Ayman for organizing this session. It's honoring us and it's giving us a chance to express ourselves in a different way. Thank you so much. I'm going to talk about the new positions and I'm going to give a rapid introduction about Africa. We know that Africa is the world's second largest, second most populous continent. Yet, unfortunately, it's also the poorest and most underdeveloped continent. And we're speaking especially about sub-Saharan Africa, where we have there 20 of the poorest countries in the continent. And we are talking about 300 million people with an income of less than $1 per day. So it is common sense that there is a huge struggle to provide essential health interventions to these Africans. And of course, by default, we will have an issue regarding chronic kidney disease, which is, as we all know, a major public health problem. And it's very challenging for both the healthcare personnel in Africa and the patients. And due to the fact that we have poor economic resources and a massive shortage of healthcare workers, we're having a big problem in Africa. The burden of kidney disease is increasing in this region due to lots of factors, as lots of exposure to infections, poor access to health care, genetic predisposition, as Dr. Hani just mentioned, and all of these are contributing further to the problems when managing CKD and acute kidney injury in the continent. AFRAN. As Dr. Hani just mentioned, the objective of AFRAN, the principal purpose, is to promote the development and to establish the scientific identity of African nephrology. But it is actually, due to the factors I just mentioned, a huge burden to achieve these targets. My history with AFRAN started in June 2021 when I was assigned Peritoneal Dialysis Chair Committee by my dear professor and friend, Professor Abdou-Niang. And in December 2021, during the Abidjan General Assembly meeting, I was proudly elected as a treasurer of AFRAN. And this is the picture we just showed where we are all gathering in it with several Egyptian members and Dr. Wissam that we are wishing for her mother the best, inshallah. I'll first talk about the PD Chair Committee because this is the part which has the longest history with me. The majority of the African countries cannot regard renal replacement therapy as a health priority. We're talking even about countries like South Africa, which is supposed to be one of the most advanced in the region, where only 48% of the patients needing dialysis can actually have it. And this slide that I borrowed from Professor Abdou-Niang is showing that in some of the African countries, we're having as low as 10% or even 6% of the patients needing dialysis who can actually dialyze. These numbers are very frightening. And if you look about what happens in adults or even in children, that we have up to 96% mortality without dialysis when needed in some of the African countries. These numbers are huge. And when you see what is actually provided, whenever someone can access to dialysis, the majority, as you can see, is in the blue color, which is hemodialysis, but the red color are those who can actually have peritoneal dialysis in Africa. Though the experience found in several developing countries like Indonesia, they are finding that home-based dialysis is more feasible in comparison to hemodialysis. And actually, they found in their study that it is less expensive than hemodialysis. What about the numbers in Africa? Well, there is difference. I mean, in South Africa, no, it is more expensive. PD is more expensive than hemodialysis. But in other countries, it's almost the same, like Sudan and Kenya. And others, it's even cheaper. So we have the option of having a cheaper option. And even in the studies where they were comparing between hemodialysis and PD regarding the quality of life, the results were very similar. And also they were very similar regarding the physical and emotional health of the patients in both hemo and PD. So could PD be the current solution, especially for the sub-Saharan Africa needing hemodialysis? For us to do that, we need to have registries, and unfortunately, the registries are not available in almost all African countries, and no reports are present for these patients. So that's what we started doing in AFRAN. We started having an AFRAN peritoneal dialysis survey, where we have our dear colleague, Professor Wesley from South Africa, who did most of the work needing it, but it was designed by all my colleagues and my co-chair regarding the questionnaire directed to all the African countries. And we were happy and proud to have all of these countries participating in this survey: Cameroon, Congo, Egypt, Ghana, Kenya, Malawi, Morocco, Mozambique, Sudan, South Africa, Tanzania, Uganda, Nigeria, Senegal, and Somalia. All of these countries participated in this survey, and we have now a progressing data gathering, which will be, inshallah, present on the website with Dr. Mohammed Gawad, inshallah. Also, since we're talking about Africa, I will quote Nelson Mandela, saying that education is the most powerful weapon which you can use to change the world. And we definitely need education and training to change the world of nephrology in Africa. Especially that the numbers of nephrologists in Africa, as you can see in the lower part of the slide, is very small in comparison to all of the rest of the world, with a very low income. So we are targeting to increase at least the quality of nephrologists by increasing the capacity to have proper education. And as you can see, the numbers can reach very, very small numbers in countries like Tanzania or Madagascar. Thanks God, we have the biggest numbers in Egypt, in Tunisia, and also many other countries of the North Africa. So we started by organizing the last Congress scientific program regarding the PD Congress, and we were lucky to have participation from very eminent physicians, including Professor Brett Coulis from South Africa, having lots of or even demonstrations with videotapes of how to do proper insertion of catheter PD and etc. Despite their absence in the Congress due to the COVID, but they came at least with their virtual presence. And we had also the participation of my dear colleagues in these talks, Dr. Dina Abdellatif, she also participated in the Congress, and Dr. Mu'taz Fathi. Another thing we have been working on, because it wasn't as active as it should have been, is the technology, the new technology webinars. And we have started organizing regular webinars as part of the AFRAN activities in different specialties. And those who will be participating will be coming from all over Africa. Regarding PD, we will have a webinar every 3 months. And these are the different speakers and different topics which will be covered during this year, including Professor Dr. Magdi Sharqawi will be also joining us. And of course, we'll start by our Professor Dr. Abdou Niang, inshallah, in March. So what are the hopes for the near future regarding the PD committee? We need financial support, because for us to be able to provide the proper education for nurses and nephrologists, we need a good financial support to have proper results. Also, the fact that PD is not available in 20 countries, which is about 50% of African countries. So we are hoping for the presence of fellowships, and it could be accredited by International Society, ISPD. And these should be done in the countries where we have actually peritoneal dialysis, with South Africa having a very active program, Senegal and Sudan a growing PD program, and all of these other countries having PD happening in their countries, in addition to some of the countries of North Africa, and hoping also to have Egypt as part of the places where we should send the Africans to go and train in PD instead of going to the other continents. Also, the provision of a PD training center or centers, if possible, in Africa is one of our dreams. And the biggest dream of ever and the biggest challenge is providing the technical support and guidance for starting up local manufacturing of PD solutions. Also, finally, because PD, lots of patients have phobia from PD, including Africa. So what about changing the culture? And to be able to change the culture, we are planning to have a patient questionnaire which is going to be designed and spread after finishing the current staff questionnaire. Regarding the other part is the recent assignment about being a treasurer, which is supposed to be responsible for the financial health of an organization. And as my dear Dr. Hani did, we always refer to our roots, because the first treasurers ever were in ancient Egypt, called overseer of the seed, or overseer of sealed things. And in our case, being a treasurer of an all-volunteer organization is one of the most important and most invisible building blocks of any communities, because it's very important to be able to gain the trust of the public and their assurance. The duties, well, most of them should be administrative and financial affairs, financial management, budgets, reports, and financial liaison. We should present an annual report to the General Assembly during its meetings. And also the funds should be in a transferable currency, US dollars. And in case the funds cannot be moved from a country, it stays in this country to be used whenever there will be a holding of a conference in the future. Regarding surfing the accounts, we should have accounts, books, and documents, and the financial year is from Jan to December. And it should be, report should be ready by April to be presented to the Board of Trustees. Our biggest challenge is our resources, where to get the money. Well, we are all discussing this with the Secretary, the President, of course, and all the different members, and trying to, after all these different meetings, to transform these different ideas into concrete points that we can actually try to achieve and gather a better finance to these limited institution. Our sourcing should be membership dues, profits from the AFRAN conferences, and grants and fellowship awards. And one of the things that we started applying now is to reduce the fees for the young nephrologists and groups to attract more and more nephrologists, especially the young one, and those with limited income in many countries of Africa, to be members of the AFRAN. Also, what we did achieve to do is to have facilitations for the payment, because there was some kind of struggling with the system and struggling with the currency that the people can, or the doctor, physicians were using. So now the system is much more friendly user for any nephrologist wishing and willing to join the AFRAN. Excuse me. One of the other things we started also to work on is offering AFRAN corporate membership to big companies and pharmaceutical companies, with many benefits to those who are willing to join us. And we have also the profits from the AFRAN conference that we had in Abidjan, and we have big hopes for our next conference in Cairo in 2023. We are also having several negotiations happening for potential grants and fellowships. Even Dr. Ayman were talking about providing these fellowships to some of the African nephrologists from Africa to the Mansoura Institute. So I'm negotiating on several projects, inshallah. And I strongly believe the importance of smaller steps. We are taking small steps in Africa, but I believe that with the AFRAN, we're going to reach very, very far. And with faith and hope, inshallah, we'll overcome all the failures and struggles and all the difficulties in our way. Thank you so much.